Well, welcome everyone again. My name is Jessica at the start, and I am a program coordinator in the Office of Community Engagement. We are glad to have you join us today. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. Please note this session is being recorded, and please be sure you are muted throughout the presentation. We encourage everyone to use the chat bar to share comments or questions for our guests at any time. This monthly series features community partners and the important work they are doing. We highlight their goals, motivations, and accomplishments, and the ways they have partnered with people and programs at MCW. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about our featured guest. Dr. Young.
Thanks so much, Jessica. Good afternoon, everybody. Hopefully everyone is doing well. As we're now in the spring season, it's always a great time for renewal and encouragement. So it's so wonderful to see that many of you took time out of your day to spend with us for our ongoing Spotlight series. Today, I have the honor to introduce Shamika May as our featured guest today. Ms. May is the shelter manager at the Milwaukee Women's Center. Shamika is committed to serving those in need and making a difference for the clients and communities that she serves. Dedicated to ensuring that everyone on her team feels empowered, engaged, and supported, Shamika has transformed their organizational culture, helping foster a trauma-informed care environment that benefits both staff and clients alike. Thank you, Shamika, for being our featured guest today. I would also like to welcome today's facilitator, Rachel Knoble, a third-year medical student at MCW Milwaukee. Ms. Knoble has been a volunteer at the Milwaukee Women's Center through the Health Advocacy in Pregnancy and Infancy program, also known as HAPPY, under the direction of Dr. Sabina Deer, who is one of our faculty members in family and community medicine. As the HAPPY co-president, Rachel works closely with Shamika to ensure the needs of the shelter are being met. Thank you, Rachel, for being our facilitator today, and I now turn it over to you.
Thank you, Dr. Young. Thank you guys all for being here. I'm very excited to have the opportunity to talk with my very good friend, Miss Shamika May. We've been working together for a while and haven't seen each other in person in a long time, so this will be nice to catch up with her too. So Miss Shamika, just kind of starting out, can you tell us a little bit about yourself, your background, and how you ended up at the Milwaukee Women's Center?
Okay, hello everyone. So my background is, well, first I'll tell you a little bit about myself. I am a mom of two boys, 17-year-old Jacob and 21-year-old Raphael. They're actually not far from MCW. One goes to Wisconsin Lutheran High School, and the other is a junior. He's a senior at Wisconsin Lutheran High School, and the other one is a junior at Wisconsin Lutheran College. So they're pretty close to the campus. So I'm a mom of two. I love what I do. Helping people is sometimes one of my weaknesses, because sometimes I do too much. But in my spare time, I love cooking. I love, spending time with my family and riding my motorcycle to relieve stress. And yeah, I am a part of the team. I never like to say I'm a boss or, someone's, leader. I just like to say that we're all a part of the team. So.
Awesome. So how did you get involved with the work you do now at the shelter? Where did you start and how did you end up in your position as the manager?
Oh yeah, you did ask that. Sorry about that. So
it's okay.
I came from long-term care. So I'm actually a graduate nurse as well. Just didn't ever take my NCLEX because I was more interested in the administration part of it. So I was in leadership at Luther Manor before I came here. I was the infection control quality assurance manager, the HIM manager, the supportive living manager. I was kind of like all over because I did my internship there as well for my healthcare administration degree. So what brought me here is I know I enjoyed leadership, but I needed more of a financial background for leadership. So I came to Community Advocates because the budget I'm in charge of is like over $1 million. So I felt like that would look good on my resume. So that was 4 years ago, and I'm still here because this is honestly, the best job I've ever had, because I have family members and friends who have been in situations with domestic violence. So it was always a passion for me. So every year I say, okay, I'm going to go look for a new job, and I'm here. So I interviewed here, and the rest is history.
Amazing. Can you tell us a little bit about Community Advocates as a whole, and then maybe a little bit about the shelter's like mission and the population that it serves?
Okay. So I'm going to go to my reference guide because, as you know, Community Advocates have so many different entities and so many different programs. So I want to pull this up just to help me out because I don't want to forget about anything. So I also emailed it to you guys so you can share it with everyone afterwards. So as you know, Community Advocates is a large part of the community. So we have programs and services from basic needs to housing services, to disability services, food shared employment training, behavioral health, of course, us as the shelter, and Public Policy Institute. So I'll just give you, a little run about what at Community Advocates, what we offer, like crisis energy assistance, which most people know about anyway from Community Advocates. Most people know, like, oh, Community Advocates help you with your, energy bill if you can't afford it. So we help with furnace replacement, low income home emergency assistance program. It's like we'll put you on that program if you can't afford to pay the full price of your energy bill. So then we'll put you on like a payment plan. And as long as you pay that payment plan on time every month, they'll wipe out the rest of the bill. So we also deal with the City of Milwaukee Building Inspector Services, homeless prevention program. We have housing stability, lead abatement, all the way down to helping people with their disability applications. We have a mental health safe haven. And then our Public Policy Institute also provides a lot of, different trainings, mental health first aid, de-escalation, verbally escalation, what else? Trauma-informed care. So then I'll talk about all of the programs that's under our umbrella, which is Community Advocates, which is Milwaukee Women's Center, and we're Division of Community Advocates. So as you know, we have the Family Initiative Program, the Family Support Center, and the Milwaukee Women's Center, which is us, Milwaukee Women's Center. So it's a dual shelter. So our Family Support Center is for our families experiencing homelessness. And then the Milwaukee Women's Center is for the men, women, and children fleeing domestic violence. And then we have the Nevermore Batterers Treatment program. We have our Older Abused Women program, where here in shelter we have 2 rooms, 4 beds that only focus on older abused women. So that's women who are 50 and older, who are going through financial abuse, domestic abuse. Most of the financial abuse is by a loved one or a child. So then we have our Power Recovery program, which is, it's an outpatient intensive drug and alcohol treatment program that's Monday through Thursday that people have to go to. Then we have our VOCA program, which is our Victim of Crime Act program, where anybody who has been a victim of a crime act throughout their life, they can get the counseling, mental health, what else is it? It's a wide variety of different services that we offer, like trauma that they deal with, and parenting skills and things like that. And then we also run the 24-hour crisis line and our Bottomless Closet for people who are in shelter who don't have clothing, that they can go in there and take as many items as they want, as long as it can fit in their room safely. And then lastly, if I haven't forgotten about anything, we have the children's program, where it's a person here's full-time, and she coordinates with a lot of volunteers to help kids with their homework. First, she creates a safety plan with them to let them know that the homelessness or the domestic violence that their family is experiencing is not their fault. So we try to tackle childhood trauma before it gets into adulthood.
Wow.
Did I miss anything?
I mean, there's a million things we could, all the amazing things that you do could go on and on and on. I want to give people a reference that like community advocates, oh, sorry, it's blurry, but this is a 6-page packet of all the things that they do for the Milwaukee community. I mean, it's truly amazing. And at the shelter itself, they have lots of different programs, as Ms. Shamika was describing, an amazing team that I don't know how you guys keep all those services straight. But I know all the people that come in and out of the shelter are very grateful and end up in a very safe place.
Right.
Um,
People, sorry to cut you off.
no, go ahead.
A lot of people know community advocates, but when they come to Milwaukee Women's Center, they had no idea that we were, a part of community advocates. So I like to tell people that as well.
Yeah, it's a team effort, especially trying to coordinate all the things that people need behind the scenes. Obviously, you provide temporary shelter for a little bit, but there's a lot more that goes into ensuring that your guests end up on their feet after they visit with you. So when it comes to like working with MCW, how did that relationship start? And what has it been like to work with doctors and students from MCW?
Okay, so honestly, it was already in place way before I came. I want to say Dr. Sabina has been working with Milwaukee Women's Center and Community Advocates. Is it over 2 decades? It's almost 2 decades.
I think it's like 13 years this year, something like that.
Yeah, and she's very consistent.
Mm-hmm.
And it's very like, you got to make sure that you're doing what you're supposed to do. And
Yep.
she's a blessing because a lot of times I'm hard to get in touch with, but she'll shoot me a text. So, but it has been amazing to deal with the Happy program because, well, as you know, Rachel, it helps us educate our clients with more, services. So basically, when you guys give education on, moms and infants and just pregnant women, and a lot of times we don't have that in shelter. So you guys are so open to introduce other topics. You like to ask the clients, when we come back next week, what would you like to hear? So a lot of time that helps us out a whole lot because it gives the clients input on what they want to learn about, and it gives you guys as, I don't want to say students, but as, volunteers and students as well, but an opportunity to learn more things to bring back to the group. So basically it's very beneficial, and I love how open you guys are because if you can remember, Rachel, I think it used to be on Sundays, remember? And then we moved it to during the week because Sundays most people are out with their families, and during the week, during lunch, more people are involved. So it's definitely been a huge asset to Milwaukee Women's Center.
Good. Yeah, we have lots of fun activities now. I know that they're bringing even more. And some of my favorite are like making arts and crafts with the kids and the moms. We would have like therapy coloring sessions for the kids would color, but I feel like it was even more therapeutic for parents and, teenagers to kind of talk through some stuff. And it was always my favorite to go to the shelter and spend some time with the folks staying there. So I'm glad that, they are having fun with it too.
I feel like you guys are more comfortable too because you have a free range to anything you want to do. We're open to as long as it's beneficial to the clients. And
yeah,
as involved is always a plus.
We try. We want to make sure it works for them. They're more excited to come, I think, back every week when we come ready to talk about stuff that they are interested in or excited to talk about. So yeah, we're on there, we're there to serve them. Might as well, we got to listen to what they say.
Yes. And even with the other entities, like from the MCW, we also have the eyeglass clinic, which is very successful. Because a lot of people here, when they're not focused on eyeglasses or their mental health or anything while they're in shelter, they're focused on housing. So the eyeglass clinic is such a success. I think they had to add more students because at first it was like just 2 or 3, but now it's like 8 to 10 that come because everybody need glasses and they can't afford them most of the time. And a lot of them are designer glasses that, people, so that's really a hit. Like now clients are asking us, well, someone told us who was a previous client that you guys have an eyeglass clinic. So yeah, so that's really a hit as well.
Yeah, that's part of home too. That's Dr. Deer's project too.
Right.
So that's part of homeless outreach and medical education. So that's a separate little group that does that too. But we all kind of work together to go to different shelters around the area. So I'm glad that it's good though. That's a fun one too. I remember like the piles and piles of glasses we have in the community engagement office of people who've donated glasses. So I'm glad that they have a variety to pick from so they can get a cute pair. Okay. So kind of going back to like what you guys do at the shelter, and obviously you're dealing with a lot of like very sensitive topics when you work with the shelter guests, but also the kiddos that come through as well. So how does your organization approach talking about these sensitive topics with the guests at the shelter? And how, do you do that in a sensitive way?
Okay. So a lot of times we like to, well, we have experts involved because our vocal counselors are licensed counselors. So with mental health and other things too that pertain to things that our client needs assistance with, we make sure we have clear guidelines. We make sure that we are we remain it remains confidential and sensitivity like to the client. Ongoing education and training for our team as well. So just to know that we know how to service and the population that we serve. Open communication, support services that we have, and most importantly, respect and dignity to make sure a person, continues to have their respect and dignity, even though that they're, in the shelter. So we make sure that it's diversity. So we make sure that all of our staff and counselors are trained to know about all backgrounds and all, different races. So that helps as well because African Americans sometimes don't like certain things or Hispanic don't like certain things, so it's just like we have to make sure that we are trained properly to make sure that we'll deal with them. And honestly, dealing on the client, I'm glad that we have several vocal counselors and different case managers because sometimes Rachel might want to talk to Shamika, but she might look at Hilda like, no, I don't feel comfortable talking to her. So it's a good thing that they have options to be able to deal with the person that they feel most comfortable with.
Yeah, you could say the same thing applies to healthcare. People want to work with someone that, they can identify with and feel comfortable with. So it's nice that you offer that to guests too. Even though I'm sure all of the people, no matter what, are very culturally competent and can help in any way. But people do definitely have preferences. So then, you're again talking about pretty sensitive topics. Do you find that most people are pretty trusting of your staff and the counselors and stuff when they come in, or how do you like break down some of those barriers and get to work with the guests that come through?
Honestly, since I've been here in the last 4 years, people rarely trust us walking in the door. Like that's just being honest. Like especially people facing homelessness or domestic violence because most of them have trauma that they've been dealing with throughout their lives where they were their parents was a person who they're supposed to trust. Their partner was a person that they were supposed to trust. Even friends and family, even medical professionals, instructors. Often people take advantage of people when they're vulnerable. So it's hard, very hard for people to trust us when they get here. But how we um, present it is we're not expecting you to trust us because we know, trust has been broken, but we do ask you to be open and trust our process to help you along the way. So that usually helps people, and then as time go on, because we're a 90-day shelter, so they can stay up to 90 days, we create a safe space for them. We make sure that they know that they know our culture is a trauma-informed care culture. We don't judge people. We make sure that no matter what background you're from, gender or whatever, you are welcome here, and we make sure that it's no judgment. So yeah, empathy and having empathy, active listening, make sure when they are being interviewed by their case manager or doing their intake, don't like to call it interview, that they feel like someone is listening to them. So also just make sure that they know that it'll be confidential. It's confidentiality. We respect their privacy. we, we're being consistent with them. We're make sure that they know that we're reliable, and we also hold them accountable for things like if you're not meeting with your case manager, how can we help you progress and get out of the situation that you're in? But the way that we do it is we just make sure it's trauma informed, where it's not like you got to meet with your case manager, or, well, Rachel, you know that in order for you to move forward, you must meet with your case manager so you can, move forward and get out of the situation. Transparency, we make sure that we are open and we don't beat around the bush. We make sure that they know that the expectations are clear, and we involve them in their safety planning where, okay, we don't want to give you things and goals to do if you're not going to participate, if you're not open. So we try to meet people where they are. So that helps as well. Just empowering them, make sure that even our staff, like, hey, how are you doing today? And, hey, we see that you got a job. We see that you, trying to, empower people and encourage people, make sure they're involved in the community if they can be, with just even sometimes we'll take them to outreach things and they'll be like, oh, okay, this is what you guys do. You know what I mean? And then just, staff training, and sensitivity and follow-up as well with clients when they transition from the shelter. A lot of times we'll make, follow-up calls and just check up on them. Hey, how you doing? And if they if they are selected for a housing plan, which is rapid rehousing or permanent supportive housing, they have to, for rapid rehousing, they have a case manager that supports them for the whole entire year, where they are doing follow-ups, doing check-ins, home visits, and things like that. And then with permanent supportive housing, it usually lasts throughout their lifetime as long as they're compliant, being up together with their mental health, their job, childcare, parenting, and things like that. So that's how we, get more people to trust our process, and then eventually trust in us. So sometimes that's where the boundaries come in, because sometimes we get too invested, and, sometimes we have to pull back, like, okay, boundaries are set, but they get so comfortable with us and they do start trusting us, which makes it hard. So we have to consistently do boundaries training.
Yeah. What's like the typical timeline for someone who will their family or whoever comes to the shelter and getting them connected with these resources? I know they can stay up to 90 days, but what's like the timeline for them typically, and how quickly are they connected and expected to like start chatting with their case manager?
So it's situational because we have to meet people where they are. So they have to meet with their case manager within our goal is the first 24 hours. Sometimes that's not likely if they did an intake on Friday. Case managers don't work on Saturdays and Sundays. So they have to do it by Monday just to do the initial intake, safety plan, and the goals, like the individualized service plan, so we can know what we need to help them with. But a lot of times, if they get here on a Wednesday and they have to do their intake within 24 hours, we're also understanding that somebody just might not be ready to talk right then and there. So we'll give them, another day. But after 72 hours, unfortunately, if they don't be open to talk to us, we might have to move forward to discharge right away, because how can we assist you or help you with what you need if you're not opening up to us? So once we get that initial intake, the process starts right away. If they need, first we start out with birth certificates and social security cards, because those are the main things that people need for housing, and if they get a housing plan and things like that. Then we move right to, okay, do you have W-2? Do you have childcare? What are the barriers from helping you get a house? Do we need to connect you to legal aid or legal action to help you get a eviction off of you because it was not a justifiable eviction? So normally within the first week, we know after we do the individualized service plan, the ISP, we know exactly what they need and where we need to connect them to. So thanks to our interns, we keep our intern, the resource binder, up to date, but they also, find other resources that we don't know about, or newer resources. So basically, like literally within the first week, they'll be connected. And then they'll have a time like, hey, you need, within the next 2 days, we need to see that you look for 2 houses, that you look for, an apartment, or you ask your case manager to give you a ride, because we'll do it where if so many people need social security cards or IDs, we'll say, okay, on Wednesday, anybody that needs a social security card or ID, Miss Karina is going in the passenger van, you're welcome to come. So basically, like, immediately, because we try to see what they have achieved in the first 30 days, because that determines if we need to, help them along the process and move forward to the next 60 days, or possibly discharge because they're non-compliant or avoidant. Or we might see like, okay, maybe they need a different type of service that'll help them because we couldn't meet them where they were.
I mean, that's a lot of responsibility for you guys to take on too. I mean, that's a big team involved in getting people set up for success, but I've seen you do it many, many times. So I know that you kind of have a well-oiled machine there now to get people exactly what they need. So what are some like things that you've continuously learned from the population that you're serving? I mean, obviously every single person is completely different, but are there things that you've learned along the way that have like really stuck from you, or that, you've taken with you as you progress in your career?
The biggest thing is, meeting people where they are. Because a lot of times we expect Rachel to be like Shamika, Shamika to be like Karina, but everybody is different, So meeting people where they are. So that's how we say everything is situational. And then a lot of the surveys and questionnaires that we give in our groups, and when people exit, like their exit interview, we also have suggestion boxes. Those also give us ideas of things like we need to change or we need to get better with. So I would say that, and then the boundaries, even though I was in healthcare and boundaries played a big part. In this population, boundaries are really hard because sometimes you're so invested with the person and their 90 days is up, and we don't discharge them. We usually 90% of the time we transition them to another shelter. So therefore we have to give a warm transfer. And then we find ourselves calling like, hey, did Rachel comply with this? Did she ever achieve this? Because she wasn't here long enough to achieve it, or she got the appointment later. So it's like the boundaries is the biggest thing, because I'm guilty of it as well as a leader, where, sometimes we're so invested that we want to see the end goal for a person. So I would say those things right there.
Yeah, it's hard, especially if you have a good bond with one of the guests or something. I'm sure if they're not, if they don't achieve all the things that you had in mind for them, it probably is a little bit difficult to let it go. So yeah, that's really interesting. When it comes to like working with the guests at the shelter, and you obviously are taking on like a lot of different responsibilities for each person, how do you help them like stay organized when it comes to like, okay, here are like the X, Y, and Z list of things that, we ask you to do? Like, is there like, I don't know. I feel like for me, if I was to come into that and I would be like a little bit overwhelmed, how do you keep them like set them up for success? I know you guys do all the right things. I'm just curious about your process for that.
Okay. So what we normally do is give a client a binder most of the time if they'll accept it. And most people have like phones, or they have notes and things that they can keep, a timeline. So what we do is we visit like meeting people where they are. So if we notice that they're critical thinking, or if they get too much on their plate, they get flustered. So we make sure we try to, it's all situational. So most of the time we'll say, okay, the first week, what do you want your goals to be? Do you want to go look for housing? Do you want to look for a job? Okay. Do you need to focus on getting your vital documents together? So kind of we group it like that, and then let them incorporate if they can do more. So we'll say, hey, today we're going to focus on your driver's license, your social security card for you and your children. And then if you have more time during the week, then try to focus on the other B, C, and D. So that's how we usually do it. And then the clients have to meet with their case managers weekly. So that's how they get a follow-up. Sometimes some clients need to meet with their case manager twice a week. So therefore, just to make sure that they're staying on path or any support they need for those services. So that's basically how it is with the ISP goal. We do the goals and say what the goal is, how you're going to get to that goal, and what's the time frame that you're going to have to get to that goal.
No, yeah, I love that. It feels very collaborative. And I'm sure, like, something I'm thinking of as you're talking to, and we've talked a little bit about this before, is just the power that you're able to give people in a moment where they probably feel powerless. It's not you telling them what they need to do. It's like, what can we do for you and how can we make it work for you? And I'm sure in that moment, that gives them back a lot of control that maybe they felt they were missing in whatever situation they came from, whether it was homelessness, domestic violence, any other situation.
Because most situations, if it's homelessness or domestic violence, they feel like they lose that power because
Yeah.
their house, things like that. So that's why we really do focus on the support groups that we give twice a week, case management feedback, just advocating for them, and data collection as well, like with the surveys that we do throughout the groups in the exit interview, because it's questions that says, what could we do better? Do you feel like we help you with this, this, and this? So most people, like 95% of the people, are honest, and we also like the bad feedback. So we always, do the question box, and also collaborating with, external partners, like making sure that, we have relationships with them so they can also, let us know that, okay, they have complied and things like that. So it takes a team effort internally and externally.
Mm-hmm. So what has been like the most rewarding part of your job? You've been doing this for a few years now and you say you're not going anywhere for a while. So what keeps you around? What makes, every day worth coming to work with like a smile on your face?
Okay. Just continuously learning from the population that we serve, and creating a culture of openness, respect, and responsiveness, and just getting to the end goal within the 90 days that they're here. Seeing families, excited about us helping them get housing, getting through the barriers, getting evictions off of their names, help them focus on their mental health, because a lot of our clients, they were diagnosed with mental health issues at a young age, but then they got older and said, okay, I'm going to stop taking my medicine. I'm going to cover it with alcohol and drugs. So I'm not going to focus on that. So just knowing that we were able to meet a person where they are, and we see success, like we help them become successful. We help them want to be better because we're caring. As also we're firm as well, but we also make sure we treat them with respect and dignity, have empathy for them at the same time. And so that's the most rewarding for me, being able to know that we can work together as a team and we all respect each other's input, and just seeing that we help the person transition successfully.
Yeah, I love that. Obviously, you're kind of dealing with some stuff that's a little difficult every day, depending on the family and the situation. How do you protect yourself and protect, your staff from not getting caught up in some of the honestly like devastating things that they see at work?
So what we do is, with our trauma-informed care training that we have, is like trauma-informed care focus / self-care. So basically giving them tips on how to take care of themselves, like work-life balance, making sure that, and I'm guilty of it too, when you're off of work, don't check your emails. When you're off of work, don't take a call from work, just work-life balance and activities to relieve stress and be able to deal with the type of situations that we deal with. Because sometimes we all cry. I don't know anyone on our team that hasn't cried, even the 3 or 4 men that we have, because some situations are so deep that, we do get emotional, and it's fair to get emotional. That's why I tell our team, like, don't feel like you can't get emotional and cry with the client, that also, knows is genuine, and they'll trust you more. So just self-care. And then like just last year, I was able to incorporate in our budget where we take a day of like all of our staff were 24/7. So our board members and our executive team, they work at the shelter first, second, and third shift. It's usually like 3 or 4 of them. And then we get the whole day of pampering my team. So last year we did, I got it catered with like lamb chops, like all kind of things. They had mimosas, everything, and they had mocktails. So we did that for about 2 hours, and then we went to a team building exercise where we played Family Feud. We did like a war room, like together as a team, and you couldn't say you're not coming because you also got paid for it. And then we ended it with Elsa's on the park. So it's like we had a whole Saturday where no one was at work. We got a chance to just, not talk about work. Of course, topics still came up, but we were able, all 22 of us were able to enjoy just being away from work and self-care. So, and I just always try to encourage people like self-care. Like the thing that they hate that I said, if you call here while you're on vacation to check on your client, you're going to be suspended for 3 days, even though it never happens. But I'm like, you need to take work away because our job is like, it's really stressful. It's hard for us to show up every day and not with also going what we have going on in our personal life. You know what I mean? So it's just like we have to max that. And sometimes none of us are perfect. I came in here without a smile on my face because my son got a D. And I'm like, I'm gonna choke him. But you know what I mean? So it's just like work-life balance is really important. So we are all as a team trying to focus more on that in 2025.
I love that. That sounds like an amazing staff retreat. Well, I'm like kind of jealous, to be honest with you. I know when like my group was conducting our needs assessment at the shelter, we got into some pretty heavy stuff too. So, we would always do debriefs and time to just like either talk with you or the other guests and the shelter workers to kind of just be like, that was really heavy. Like we need to
Yes.
take a second after the guests leave the needs assessment, and figure out what we can do to help while also not taking all that stress like home with us and taking it as like a personal, thing. Like obviously we're all here to help in this world in our careers, we're all in a position to help, but it's good to take care of yourself.
And it really helped with our executive leadership team. Well, I report to the CEO and the CEO. So CEO for like reports and things like that, and the COO for organizational operation things. So to see like our CFO come in and he's here for like 3 or 4 hours, like he's been here for years, like I think like maybe 15 or 20 years. The next day he's like, Shamika, I have a whole new respect for the shelter. I don't see how you do it. I'm on the phone on the crisis call. Some client is asking for diapers. Another one wants to get let in the clothing closet. He's like, I didn't know what to do and which one to do first. So it
It's
also
overwhelming.
it also gave them, a synopsis of what we do every day. Even though like our CEO and COO, they are really involved, but most of them like, they focus on their area. They don't come to the shelter often, especially taking a 3 to 4 hour shift.
Yeah.
So
Yeah, you definitely have to be immersed in it, I think, to fully understand it.
yes.
So we had a question in the chat. Sorry, I just have to expand the window. So Sarah O'Connor, she put in the chat, she's wondering about the ways that MCW students, staff, faculty can be good partners to the Women's Center and how can they show up for your organization?
Okay. So first and foremost, we only work off of donations and grants. So we have had a significant, decrease in our grants. I'll give you an example. One, we used to get 187,000 a year. It went all the way down to 66,000 a year. That's a big, chunk. So donating financially, in-kind donations. People don't think that that's is helpful. Gently worn items is a plus because a lot of people come here with nothing. Volunteering your time, creating like workshops. If someone's good there with financial stability, teaching a person about their credit or anything will help, advocating for policy change. Sometimes a lot of people in their role also have more, connections to be able to help make a change. Just raising awareness and yeah, things like that. But the biggest thing is financially, just donations and things like that. That really helps us. Even donating meals. We our goal is to have someone donate us dinner every night because it's costly for us to have to, because we have a cook, as you know, that's here 7 days a week for like 4 hours cooking dinner. We're the only shelter that provides a hot meal every day, but it's costly because we are way over our food budget. So someone donating us money to make a meal or even a meal. So that's the biggest thing that, we need help with in order to stay open. So thankfully we celebrate 45 years in May. So I also put the link in there for sponsorships or donating, because our goal is to raise a lot of money. So
Yeah. I know that we did a coat drive. I don't know if anyone at MCW remembers the boxes of coats that we had. So,
yeah,
there's little things. I think we ended up donating over 100 coats because people were sick of having their kids random small coats in their house. And I
yes,
remember and we had backpacks and gloves and all those things. And the
yes,
kids were always so excited when we walked through the door and they could pick out a new coat to wear for the winter. So even I know obviously having the money helps in so many ways, but if you're able to give clothing, anything, people
time.
people are very excited. And
And
baby things, I remember we bought baby clothes and little kits for newborns and stuff like that, and people are always so grateful. And I know we talked like cooking wear, things for like transition. We did a cleaning
yes,
supplies drive.
you
So
did you
there's
have a little like pack right with the tissue and the cleaning products, and we
Yeah, the little buckets.
the
Yeah,
little,
that was me and Daphne who did
yeah.
that.
So that's a success when people transition to their home, because sometimes we have funds to help people with furniture or cleaning products or things like that, but it runs out, so that's
Mhm.
a plus. So honestly, the in-kind donations, and people get tax write-offs. Like they get a tax write-off for what they donate to us. And we try to encourage that so people know like it's beneficial, because the clothing closet is like one of the biggest successes where people don't have anything, so yeah, that really helps.
Yeah. How do you suggest, like, when people come to the shelter and, if they do a workshop or do some other type of volunteering, like, how what's the best way to connect with the guests, and what's, the best way to, bridge a conversation if you don't want to, stress them out, basically?
So basically, most clients are open to anything that they can benefit from, you know, especially like a lot of them say, okay, I want to help with my credit. I want to be more financial stable, but I don't make a lot of money. So, how can I invest in stuff? Or they'll say, I want to be a better mom. What can I do to have uncomfortable conversations with my children? So it's all, no matter what you come up with, if it's something that you feel that any population, especially ours, can benefit from throughout their life. So basically, that's why I always tell people like, it's really up to you. If you feel like you present something to me and it's beneficial, I'm open for it. But they can easily call me or call Jerry, as you know, and they can come in and just get a feel, or either ask one of the case managers or ask me like, what you think will be beneficial, coming up, and especially with help with people with they don't take care of themselves. They don't take care of their blood pressure. They don't take care of their diabetes, like even things like that, like health things. Like they don't understand that, having 5 kids can be stressful, and you won't have time for self-care. So just teach it like it's a wide variety of things that people can, help with, and it will be beneficial to the population that we serve.
Yeah, for sure. I know for Happy, like we always try to come in flexible. We'd make a semi plan and then go with whatever people wanted to do. I'd always bring along my very good friend Hannah, who would play with the kids to give mom a break. Because, you know, if you have a friend and you want to go with your friend to do something at the shelter, I suggest bringing someone who likes kids so someone can hang out with the kids while mom or dad or whoever gets, or big sister gets a break. That was always something that we tried to do. And I know you've always said, like, meeting people where they're at, you know, you come in with a plan, but be prepared for anything, really. And that's just like anything in service, you know.
So, and people don't understand, like, we're a 75-bed shelter right now. I think we have 71 guests. Out of the 71 guests,
Wow.
48 kids. You know what I mean? All different ages. And a lot of the teenagers, they don't want to be around the little kids when you guys come. So some of them, as you notice, like, the teenagers want to have one of you guys and like, okay, can we talk about this? So, you know, they don't want to deal with it. And most of the teenagers here, they have 3 or 4 little brothers and sisters that they don't want to be around. And they're in this room with all beds, and now their siblings really getting on their nerves. So,
yeah, it's you know, it's fun. That was the first, I think, going back to the shelter was the first time I like tore it up on the playground in years because some kid wanted to play play a game outside. So tap back into like my inner child, but
right, exactly.
But it's fun, you know. Okay, so we talked a little bit about like what people can do to support you, obviously, but what's like the biggest thing you want people to take away from, you know, our chat today, or just even the work that you do?
Okay. I would say overall, just supporting individuals and their families who's um experiencing homelessness and domestic violence. Just have empathy, take action, you know, get involved in the community. Whether it's contributions, volunteering your time, offering, you know, professional expertise. Because, you know, great to have you guys here, and you are very knowledgeable, you know, about healthcare. Just advocating for systems change and just showing up. People don't think that volunteering helps. It really, really do help. And you know, we all play a role in breaking barriers for people, like just providing dignity and respect if they come to the emergency room. You know, active listening. You know, being open to their situation and not judging them. So, just regardless of their past or current circumstances. So, just always be able to be open and be willing to help someone thrive so they can be successful and not get back into the situation that they are currently in. So that's
that.
yeah.
Yeah. I mean, there's so much intersection between this and the healthcare system and any other, you know, system. So it's a good reminder to us to, you know, be open and willing to listen to anybody's situation and be non-judgmental because we don't know what people have been through. So
it's like my thing is learning is lifelong. So I've never met a perfect person. So just always remember that coming here, you can learn a whole lot of everyone's background. And then like a lot of people like to, you know, wait for the change to happen. I feel like let's be the change and make it happen and make a lasting impact in the community for, you know, the population that we serve.
Yeah, and I will make a plug too. My time at the shelter has definitely been the most rewarding thing I've done in all of my med school. If you haven't been there, you can ask for a tour. You can see all the amazing things and get a note, get a good look of that the closet that they have for people, which is very wonderful and all donated stuff. But I do think it reminds me that, you know, we're only as good as the like people that we work with. Like you have to learn from people that you serve. And I have learned more than anything else that being in the community is the best way to learn about the people that we serve. Obviously, you can talk to individual patients, but seeing the situations that they come from is the most impactful thing. So, you know, I appreciate you chatting with us today and working with me all these years and Dr. Deer. So I'll turn it back over to Jessica now that we're kind of Thanks, Dr. Nelson. But he's putting Dr. Nelson's great. But I'll hand it back over to Jessica to kind of close this out. But thank you. I mean, it was amazing to see you virtually. I wish I could see you more in person, but I'm working so much.
Oh, I totally understand. And moving forward, when you leave, because make sure you tell the other ones who's following behind you that take the approach that you have, because I am a busy person and you are always consistent. Like, Shamika, I just want to move my email up to the top. You'll text me. So it's like, and that's a plus, because just coming in and taking the lead is what we need.
I try. I always just I was like, I need to come and I need to see my friends at the shelter. So
so you will be missed.
I just want to echo, thank you again, Shamika, for sharing with us and letting us in. But also, I want to give a shout out to Rachel, because you are our first student ever to facilitate our spotlight session, and you did an amazing job. I second Dr. Nelson. You need your own podcast. Let us know when that is ready, and I'll share the link for you, for everyone. But thank you, everyone, for joining us today. We are so grateful for you and who continue to join us every month. We will be sending out an email in the next day with the resources and links shared today. Please consider filling out our event survey. It only helps us get better. And make sure that you join us next month for our next spotlight session. More details will be shared soon. But otherwise, again, thank you, Shamika, Rachel, and our audience for joining us. We hope that you have an amazing rest of your day. See you next month.